Good morning. My name is Caitlin Astor. I'm a nurse practitioner student with Auburn University. I'm going to be talking about plantar fasciitis. Main thing about plantar fasciitis, it is a painful, inflammatory, or degenerative overuse of the plantar fascia at or near the origin of the calcaneus. It is due to collagen degeneration secondary to repetitive microtrauma of the plantar fascia. The site of abnormality, as this picture shows, is typically near the site of origin and the medial tuberosity of the calcaneus. And sometimes in diagnostics, the direct palpation of the medial tubercle often causes severe pain along the aponeurosis. This is diagram of the digital slips and the aponeurosis. So there's a better understanding of the structure of the foot. What places people at risk? Typically overuse, such as occupational overuse, such as nurses, athletes, dancers, people who have to be on their feet for prolonged periods of time. Also flat feet or high arches, obesity, age, and improper shoes. 3 key questions to ask patients when diagnosing this condition: the timing of the foot or heel pain. Plantar fasciitis is usually worse in the morning and after periods of inactivity when one first starts walking on the feet. Social assessment can also be helpful to identify risk factors that were mentioned earlier and what kind of footwear is worn. Also, we need to find out from the patient the exact location of the pain, because the diagnosis is often based on a history and the presentation, plus defining focal point tenderness. Physical components to examine. Tenderness should be best elicited by dorsiflexing the patient's toes with one hand to pull the plantar fascia taut, and then palpating with the thumb and index finger with the other hand along the fascia, moving from the heel to the forefoot, locating the points of discrete tenderness. This is a characteristic finding of plantar fasciitis. X-rays can be helpful, especially ruling out differential diagnoses such as stress fractures, osteomyelitis, possible malignancies. Ultrasound can show thickening of the plantar fascia, suggestive of plantar fasciitis and inflammation. And MRI can also be done if all other measures are inconclusive. Most common treatments with expected outcomes: performing stretching exercises of the plantar fascia and calf muscles by the patient at home. The result of this is increased flexibility and decreased tenderness of the muscles and the fascia. Avoiding the use of flat shoes and barefoot walking. The outcome would be decreased pressure on the calcaneus and adjacent structures. Using silicone shoe inserts or heel pads that provides cushioning and decreases pressure, which will lead to decreased inflammation and pain. Short-term use of NSAIDs, which also helps to decrease pain and inflammation. Severe cases of injecting plantar regions with glucocorticoids or local anesthetics. And refractory cases may require additional measures such as orthotics, night splints, casts, or extracorporeal shock wave therapy. Teaching components: perform stretching exercises of the foot and calf muscles before physical activity. Wear properly fitting shoes, sufficient arch and heel support. Avoid standing for prolonged periods of time. And weight loss if appropriate to decrease the pressure put on the feet. And these are the sources I used. Thank you for listening. And that would be it.